Okay, I wash my hand before I enter my patient room. Hi, my name is Annie. I'm the nurse practitioner student. I will helping you today. So before we begin, may I ask you for permission to videotape and upload to YouTube?
Yes.
Okay, so thank you. Now I will wash my hand. I have my instruments clean by my side. Okay, so today we will do the physical exam about the pulmonary area. So could you take off and cover your shirt? Yeah. So the first thing we do for the thoracic physical exam is to do the inspection. I will do the inspection of the anterior and posterior of the chest. I will look for the chest movement. Is that symmetrical? I look for any lesion, bruises, any deformity of the chest. I see my patient sitting comfortably. I observe the respiration rate, respiration effort. I see that my patient have the respiration even in labor, no tripoding. The diameter, the ratio diameter of the anterior and posterior to the lateral chest diameter is 2/1. May I see your nails too, please? Okay. So I inspect the nails for clipping. I see the color of the nails and color of the lips, color of the overall chest area. Is it normal to raise? No diaphoretic, no cyanosis. And I see that the chest rise and fall evenly, symmetrical. And when my patient take inspiration and expiration, I don't see any grunting, no retraction of the accessory muscle, no retraction at the supraventricular muscle, or contraction of the abdominal oblique muscle. Okay, so we will continue with the second part, that's the palpation. So for palpation, we will, I use my dominant hand. I will palpate over the chest area, and let me know if you have any pain when I do the palpation, okay?
Okay.
Do you have any pain?
No.
Okay. So for the palpation, I will also palpate for the tenderness of the costochondral joint. The costochondral joint is the joint to connect the rib and the costal cartilage. So when I palpate, I palpate the anterior. Can you raise up? Okay. I don't feel the any deformity of the bone, no bruises, no tenderness, and also I try to palpate for the crepitus. That's the cracking sound of the air under the subcutaneous area. Okay. Also in the palpation, I will check for the tactile parameters. That's in the transmission of the sound through the bronchial pulmonary to the chest wall. So I use my palm, use the base of the palm. So when I apply my hand on your chest, just say 99 repeatedly. Okay, I will do in the anterior and the posterior area. Okay, so
99, 99, 99, 99.
okay. I do it the posterior area. Let me adjust a little bit here.
99, 99, 99, 99, 99, 99.
Okay, so when my patient say 99, I'm able to feel the vibration of the sound. So that's the healthy lung. And the next thing I will do is the respiration excursion. So because I'm already in the back, so let me move the chair a little. Let me move my camera. Can you like sit down? Okay. How about you turn to the side? Yeah. Move. Yes, I want to show my. So because I'm already in the posterior area, I do the respiratory excursion. I use my thumb to put approximately at the 10th rib, and then I use my thumb to push up to create the skin fold. Okay, can you do a deep breath in, please? And so when my patient take a deep breath in, as you can see that my thumb move symmetrical, evenly downward. So that's it, the chest. The respiration excursion is symmetrical bilaterally, and okay, you can tell that. And then I can do the same thing. The same thing in the anterior. So usually it will be easier when the patient supine, but this is now the. Okay, take a deep breath. Okay, so. Okay, that's it, the respiration excursion. So now, the next part will be the percussion. Percussion is the technique to check for the underlying tissue is airfield, fluid field, or consolidation. So I will use my non-dominant hand, put over my patient chest wall, and then I use my dominant hand, use my middle finger to strike over the PID joint, and I try to avoid the scapula or the rib because that area will have the donut sound. I will start from the very top. I will do bilaterally. Okay. I also do in the back, in the posterior, try to avoid the scapula and the rib area. So overall, I can hear the resonant sound to the overall lung region, and because this is the percussion, so I also try to percuss the the diaphragm percussion. So first of all, I will tell my patient to take a deep breath out, and then I will percuss until the area I can hear the change from the resonant to dullness, and by that time I will tell my patient to take a deep breath in and hold it, and then I will continue to percuss until I reach the point where I notice the change from dullness, from resonant to sound, and I will mark it again. So now I will do on the right side. So sir, can you try to exhale and hold it? Okay. This is the area where I notice the change. And can you take a deep breath in, please? Okay, so this area, I notice. Okay, you can take a deep breath out normally. And then now I will use my tape to measure the distance. So the distance is 5 centimeters. And then I will repeat to the other left side. Okay, can you take a deep breath out? Okay, here. Can you take a deep breath in, please? Okay, I will measure. It's okay, sir. It's a little bit over 5 centimeters. Okay. So the next part will be auscultation. So auscultation is a technique to listen to the airflow through the tracheal, bronchial, pulmonary tree. So I will listen from the very top of the lung, from the apices of the lung, bilaterally, and I will move downward at the ladder sequence and move from top to going down, and then I will do the same thing in the posterior, and then I will listen to the 3 point of the axillary side. So when I apply the diaphragm on your chest, so just take a deep breath in and out. So I will try to take to listen to the full respiration. Okay. Now I will listen over here. Good job. Okay, now I will move to the posterior. Okay, so I'm able to hear all the area of the lung region, lung clear to auscultate. I hear the vestibular lung sound, and so I also want to do another test that's called the esophageal test. So this test is the esophageal test is to instruct my patient to say E, and then I will listen with my diaphragm of the stethoscope. With the healthy lung, the E, I will hear the muffled E when I auscultate. But if I hear the E turn into A, it will indicate that there is a consolidation of the underlying tissue. So when I apply this diaphragm on your chest, just say E repeatedly. Okay?
Okay. E, 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 E.
Okay, so with my patient, I'm able to hear the muffled sound of the word E. So it's indicate this is the healthy lung. Okay, that's it, the finish of the physical exam. Thank you.
Thank you.